Welcome back to the Other 40s Fitness Podcast. My name's Tristan Lowe, and today we're mid-December 2023, and I've got some results to share with you if you're interested. And it's once every year I go and have my blood test done, and I cover a lot of subjects on my body in the blood test. And the one that I want to just touch on today is testosterone levels. Now, I'm a 53-year-old man, and you'll know, if those of you that know me, I'm a professional in the fitness industry. I'm a qualified personal trainer and sports massage therapist, and I've been exercising in sports and fitness since the age of 11. So that's a full transparency from the offset, but we'd like to talk about testosterone. Now, what I've done here's the sheets that I get from my surgery in Lincoln. And I've just covered up my full names there, Tristan Lowe. I've just done covered up my date of birth. Now, if you look here, you'll see, I'll bring it close to the camera. All right, the light's flashing there because I'm underneath the light system. Okay, so let's talk about it. My readings taken in late October this year were 602 nanograms per deciliter, and that's the serum testosterone level. Now, what is testosterone? It's a male hormone, sex hormone, which enables us to procreate, and it also gives us our male or our masculine traits, as in stronger bones, more muscle mass, hair growth, and it's essentially our sex hormone. All right, now, testosterone levels, there's a lot of talk about it at the moment, and there has been for a while, but with the advent of the internet, social media, and of course YouTube, there's more discussion on it. And as a personal trainer, I train a lot of men, usually over the age of late 30s up until, I'd say, mid to late 70s. I've been training men and women, but today we're just talking about us, testosterone. I've been training them for years, and I think it's very important, and I do part this information with my clients and say, look, go and get this done. Go and get your testosterone levels checked, if not once a year past a certain age, certainly past the age of 40, then once every maybe 18, 24 months, but I would say at least once a year. If you've got low testosterone levels, the early warning signs are poor sex libido, poor physical strength, poor concentration, possibly erratic sleep, bad eating habits, erratic mood patterns, and essentially a low level or a poor level of energy, or even physical energy, and even mental or emotional balance to tackle daily stresses and tasks. All right, so suggestions. Once you've gone and taken your blood test, or your full blood count, and they'll give you a whole lot from hemoglobin to gonadotropin levels, testosterone, cholesterol tests. We're talking about this one. Again, if you look here, if those of you are watching on YouTube, you've got a reading there, 20.9 nanomoles per litre, which equals 602 nanograms per deciliter. All right, so let's take into account that I exercise at least 3 times a week, usually resistance-based training, weightlifting, that's using barbells, dumbbells, kettlebells, medicine balls, resistance bands, TRX training, body weight exercises. Sometimes I do some boxing on the punch bag just on my own, just to warm up, and at weekends I might ride my bike and go on trekking and pack walks. But essentially, there are 2 or 3 things that can have major influence on our testosterone levels, and the first is not your age. All right, the age comes into it, but it's not the most important thing. In my experience as a professional and people I've trained, it's a combination of 3 things: quality sleep, quality nutrition, and resistance-based exercise. Your age comes into it, but it's not the first and foremost. It's your lifestyle and the way that you live your life. Now, as I walk around my city where I live now in the UK, I'm born and bred in London, but raised of the last 13, 14 years, worked in Lincoln. And I, on a regular basis, 5-6 days a week, walking through the city centre, I see men my age, and quite often perhaps up to 20 years lower, at least late 20s up until early 50s, that are fat, that are overweight and carrying excess body fat. And it's highly likely, it's a very high probability that they've got low testosterone levels and their estrogen levels in their bodies are increased. And that's due to poor diet, poor sleep, excess alcohol consumption, and lack of exercise, and of course, the diet, the nutrition. This thing about there's a trend at the moment in becoming vegan. And it's not always a religious or cultural thing. It's almost a hip and trendy thing that's being blatantly pushed onto youngsters, young men. Now, if it's for religious reasons, I travelled to the Far East last year, and for religious reasons, I've been to South Korea, I've been to Nepal, and next year I'm travelling to Japan. And I've seen in different religions and cultures why some people don't eat meat. But at the moment, there's a push for the Western world, that's the UK, parts of Europe, the USA, Australia, Canada, these countries, to convince us not to eat meat. All right? Now, I'm not a doctor, okay? I'm not a surgeon, I'm not a physician, okay? I'm a personal trainer with a lot of experience. Now, and if you don't eat meat, I've trained some quite good athletes that don't eat red meat, but fish, yes. Okay, certainly they'll eat fish. But you need to make sure you get quality sources of protein in your body. And again, if you've had a medical diagnosis from your GP, your surgeon, your nutritionist, that you must 100% avoid red meat, then maybe, again, or if it's religious or for cultural reasons. But other than that, we should do. You should eat a steak once or twice a week, at least once a week. You should eat lamb and beef, and then of course white meat, chicken, fish. And equally, that's a very good source of protein after eggs. But your testosterone levels, if they're low, you're going to find it literally hard to get out of bed in the morning. And not always like it is now in the middle of winter. You're going to find it hard to get out of bed in the morning, even in spring. You've not got that, that's no pun intended, that spring in your step. So go and get your blood test done. It costs you nothing. If you want to go private, you can get it done quicker. Go and get your blood test done. Have your results done. Again, just to recap here, I've got a reading, age 53, I'm smack bang in the middle. Average readings of 602 nanograms per deciliter or 20.9 nanomoles per litre. Okay, do the equations, the charts are out there for you to look at. With the advent of drinking water in plastic bottles, the chemicals they use to make plastic bottles contain chemicals that damage our body's natural defences, and one of those will be testosterone. They affect our endocrine system, they affect our testosterone levels. So my advice, if you're drinking water at home, drink it out of a glass or at the very least a steel cup. If you've got a bottle that you take with you out to work or training or fitness training, buy a steel one. If it has to be a plastic one, try and get one that's BPA logo. But even then, it's still a plastic bottle and there's harmful chemicals in it. So where you can, use steel or glass. If not, if there's no choice, then you have to go with plastic. So that's something else that's damaging our levels. So I would say look at those telltale signs again. Okay, you've got a low sex drive, you've got low physical strength, you're predisposed to injuries, predisposed to illnesses. You know, I've had clients that always seem to be ill, yet they're constantly ill. Men, they've constantly got some form of illness, and it's not the same one year in, year out. They've always got a cold, always got flu symptoms, always run down. And again, it's not their age. Often it's a lack of good quality, unbroken sleep. And I wouldn't say a poor diet. They quite often, because the clients I train have the resources and the financial resources and the intelligence to buy good healthy food, but often that's also, it's kind of marred or matched by regular alcohol consumption, regular late nights, poor sleeping patterns, so it can throw out the hard work they've done with exercise and good nutrition. So it's imperative that you don't leave it. In the same way that if we had a hole in the back of one of our teeth, we'd go and get it checked out and go and get the dental surgeon to fix it, to fill it, replace it, or whatever. Right? This is actually something, because we can't see our testosterone levels. There's nothing to see. It's not like you break a bone or you rip a ligament or you break a bone or you get I don't know, chicken pox or something that's visible when you're ill, or if you've got a leg injury, we can see it. Or if you get a hematoma, a blood surface into the skin, that's something we can see. But when it comes to something like our nervous system or testosterone, we can't see it. So the suggestions are you go and look into your body by getting those blood tests done. All right, remember the 4 things we need to do: lift weights, sleep well, eat a high protein and vitamin diet, and of course repeat those on a regular basis. And if you've got a low sex drive, okay, that's one of the biggest telltale signs that your testosterone levels are low. Go and get them checked out. Don't leave it. Don't wait until you're 90 or 80. If you're in your 40s, certainly 40 and over. Yeah, and the NHS, they are obliged to take those tests for you and give you the results. And they'll give you a nice sort of printout like this, and they'll give you all the readings. And you can ask them questions, and often they've got the answers. So get it done. My name's Tristan Lowe. It's the Over 40s Fitness Podcast. And here we are coming towards the end of the year. And hopefully in 2024, we'll have more discussions to have. Okay. Feel free to like, subscribe and share this channel. It'll help it grow. Thanks for listening and watching.